Today we are going to discuss an important topic, mental health issues. For that, we have our expert, Dr. Hemika Agrawal. We will be trying to understand the various mood of disorder, personality and bipolar disorder in consecutive episodes.
I am Dr. Hemika Agrawal. I am a psychiatrist practicing in Noida and Ghaziabad, and I am also associated with Fortis Hospital, Noida.
Before we move towards mood disorder, we wish to understand what is mental health issues or disorder.
See, psychiatric or mental health disorders are a wide range of symptoms and disorders which have been classified, and as per ICD-11, which is now followed in India, we have a vast majority of symptoms. Like the disorders vary from mild mental health issues like mild anxiety, depressive symptoms, to severe mental health issues like schizophrenia, dementia, etc. Even personality disorders are included in mental health disorders. Then we have child disorders like autism, mental retardation, which is now mentioned as intellectual disability, and then we have specific learning disability or SLD, which is common in schools nowadays and people are gaining awareness about it, and many others. So in all the symptoms, for the common person it is important not to go by the technical labeling of disorders, but to realize the important symptoms which refer us or which give a hint to us that a person might be suffering from these kind of mental health disorders. There could be some mild variation in sleep, appetite, weight, or it could be changes in mood, irritability, being withdrawn, being extremely upset, or having crying spells, or even suicidal thoughts in any way, in any form, in any frequency or intensity, are a very important sign and a red flag sign that a person might be suffering from a mental health issue. So for us, it is more important to see the symptoms. If there is a drastic change in the behavior of a person, acute change and a drastic change, it is a definite, again, a red flag sign that the person needs to be taken to a mental health expert. So if a child, and also if a child suffers from educational problems, we should also think on the terms of the child needing help from a mental health expert. There could be underlying depressive symptoms or some SLD, specific learning disability like symptoms, or something else which is plaguing the child, and they are usually missed by the schools and teachers. Although nowadays we are having good counselors in schools also, they do take care of these things in schools and they refer timely to the experts, but many schools do not have these facilities, and all the teachers and all the parents are not yet facilitated and sensitized to picking up these issues. So it is important for us to learn and to pick up these signs and symptoms early and take the person suffering from them to a mental health expert.
Let's understand what is mood disorder.
Mood disorders is a wide term, as it is an umbrella term under which many disorders like depressive disorders and bipolar disorders are included. Depressive disorders are characterized by times of extreme sadness, irritability, being withdrawn, not having pleasure in previously pleasurable activities, loss of appetite, loss of sleep, loss of enjoyability, loss of motivation, anhedonia, etc. So such episodes are common in simple depressive episode also, and also a depressive episode which occurs in bipolar disorder. But in bipolar disorder, we also have episodes of mania, which cycle with the episodes of depression. So we have in bipolar disorder shifts between depressive symptoms and manic symptoms. So what does a manic episode has in bipolar disorder? The symptoms of manic episode are increased energy levels, increased agitation, anxiety, restlessness, sometimes increased confidence, increased goal-directed activities, and if a manic episode is unchecked or untreated, that may lead to a cascade into even extreme violence. And people suffering from bipolar disorder are very vulnerable to suicidal attempts and even completed suicides, successful suicides. So this disorder is very important for us, and when we hear incidences of suicides in our society, we tend to retrospect as to what was the reason behind them, and in many cases depressive episodes or bipolar disorder has been responsible for them, untreated episodes especially. So if we can treat a bipolar, if we can firstly detect a bipolar disorder or a mood disorder timely and treat them, that will be very good for the society, because it will prevent a lot of suicides and a lot of repentance later on. Suicides are preventable.
How could one can understand that someone is suffering from bipolar disorder?
Again, as I just mentioned, can have both depressive episodes and manic episodes, the symptoms of which we have both discussed just now. But what is important is any change in behavior in any person, suddenly, drastically, with or without any reason, should raise a possibility of any psychiatric illness, including mood disorder, including bipolar disorder, and such a person should be taken to a mental health expert as soon as possible. Especially changes in interaction, in the public interaction. If the public interaction either increases or reduces, if the sleep increases or reduces, appetite increases or reduces, if a person's socio-occupational disruption occurs, that is, the person's social integration in the society is disrupted, or the person's occupation is disrupted in any way. If a person is a child or a student, the studies are disrupted. If a person is working, the work quality is disrupted, or there are complaints from the workplace. These should all warn us that the person might be suffering from some mental health issue like a mood disorder. We should not try to diagnose it ourselves, but we should just be sensitive enough that it could be a possibility, and let us take this person to a mental health expert. That's important.
That is, find out it is treatable. Is there any medicine that is also given?
Yes, definitely. There are medicines for both depressive episodes, manic episodes, as well as mood stabilizing agents. And medicines are not the only thing which are available. We also have counseling or psychotherapy available today. And experts who are trained in therapy, they deal with these things very sensitively. Here I would also like to add here that many a times family members say that what about counseling? Counseling तो हम खुद ही घर पे कर लेंगे. So there is no need to take the person to a counselor. But here I would object, and I would tell you that contrary to the belief, counseling has its do's and don'ts. If counseling not done by a trained person, if not done by the proper do's and don'ts, if the proper rules are not followed, it can even be harmful. It can even increase suicidality and depressive symptoms in a person. It can push an irritable or a manic person to commit homicide or suicide or harm others or self. And therefore it is important that we do not take counseling or therapy lightly and leave it to the experts. Experts will guide us as to how to deal with the person at home, and we should follow that, and we should not try to like a surgeon doesn't do surgery on his own relatives. In the same way, the family members should refrain from giving counseling or trying to counsel their own family members, for they are involved with the patient, and secondly, they are not trained for that. So we should leave it to the experts, but we should definitely seek help and not brush such problems under the carpet.
Let's check with the doctor. Hospitalization is mandatory for the treatment.
See, every case is different. The severity, the intensity depends from case to case, and the label itself does not justify hospitalization. What I mean to say is that a person suffering from bipolar disorder doesn't need to be admitted all times. A person suffering from mild illness can have a peak in the illness and maybe needing a hospitalization, and a person with a severe mental illness might not need a hospitalization at that time. So it depends from case to case. The indicators for hospitalization, emergency hospitalization in psychiatry or mental health disorders are suicidal thoughts, risk of harm to others, violence, extreme disturbance with sleep, extreme loss of appetite, which can be a threat to one's health if a person does not take enough nutrition. Those things are these are the common indicators for risk of indicators for admission need in a person.
Is there any hospitals or doctors recommended for the treatment, or patient should be visit the general physician?
In psychiatric issues, definitely a psychiatrist should be involved. The setup may change. We do have psychiatric setups purely which cater to psychiatric patients, and we have setups which cater to both psychiatric and general health patients. A person who's suffering from both psychiatric issue as well as general mental health, general physical health issue, they should be taken to a place where the facilities for both are available. But our licensing, the laws of 2017 Mental Health Care Act clearly tell us that psychiatric treatment has to be done at a place where licensing has been done. Especially the admission process should be done in a place where MHE licensing has been taken, mental health establishment license has been taken under MHCA Act 2017. So irrespective of the place, whether it caters to general physical health issues or it is a purely psychiatric setup, licensing is essential. And if there are comorbid issues like a person suffering from cancer or a person suffering from electrolyte disturbance, if such issues are there, they should preferably be admitted at a place where general physician or other specialities are also there and they can take care of those issues.
Many times we heard about suicide due to suffering from bipolar disorder.
Suicides are very common in bipolar disorders, but not just bipolar disorder, they are common in all mental health disorders, and any untreated illness can lead to suicide. And we should be very careful about the treatment process. See, according to a study, around 25 to 60% of patients suffering from bipolar disorder had attempted suicide in their lifetime, and between 4 to 19% had completed the suicide attempt. They had been successful in attempting suicide. The person should not be left alone at all. If such a person ever even fleetingly mentions thoughts of harming self or harming others, it should never be taken lightly, because such thoughts have been, as per the studies, have been shown to result in actual cases, incidences of harm to self or others, like suicide or homicide sometimes. And if we take every threat seriously, such threats seriously, we will be able to prevent cases of suicides and homicides to a large extent in society. So yes, this is very important, this is very sensitive, and such incidences are preventable by being sensitive here.
How could family, friends, society, and government help?
See, we should try to understand the reason for committing suicide here. The disruption in the life of a person suffering from bipolar disorder, like the highs and the lows, and the period in between when the person is normal and is suffering from the load of the episodes, that is very high. The person is trying to manage his family, so social work, societal norms, he's trying to fulfill his societal duties, and he's trying to maintain a work environment and a work relationship also, and with that he's suffering from an illness. So that sometimes takes a toll on the person, and the person can attempt suicide during severe depressive episodes, manic episodes, and even when the person recovers from these episodes and realizes that the illness has devastated his life and the losses he has. When the person realizes about the losses, it can create a havoc in his mind, and sometimes people after improving also commit suicide. So what is important for us is to understand that the people who are nearest to the person, the family members, they are the first people who can be of help to the person. They can prevent such attempts by being there, not abandoning the person, not thinking that the person is doing these things voluntarily, but realizing that the person is suffering from an illness which is not in his hands. The treatment, of course, is in their hands, but the illness itself is not the person's fault. So we can be empathetic, the family members can be supportive. The spouse should understand the problems of a person suffering from an illness, take the person to seek help, psychiatric help at the appropriate time, and not abandon such a person, because the abandonment increases the load of such a person. The state or the government should also realize that the person suffering from such illnesses needs support as well as protection. They need protection from job loss as well. There should be laws and rules to prevent people from being fired because of these illnesses. Although there are rules, but the implementation is not very well, and a lot of times such people end up losing their jobs, which increases their burden and leads to increased risk of suicide. The employer should also be a little empathetic, and try to absorb such people in the system instead of firing them.
Is there any specific age or this issue is found in all ages?
See, bipolar disorder has been shown to have peaks. A peak usually occurs in the late teens, like 17, 18, and another peak has been seen to occur at approximately after 15, the first presentation peak, that is to say.
What are the common causes of disease?
There is no particular reason. The reason which we postulate is genetics and how the body is being made, and the composition of the genetic composition is usually responsible for these things. It is not the external factors which are alone responsible for these things. The genetic predisposition has a lot to play. Also, the family history is important here. A person who is suffering from such cases will have an increased propensity of such illnesses in his first degree relatives.
It means genes play an important role.
It does have a very strong genetic predispositions in bipolar disorders. Genetic studies like twin studies have shown that there is an increased inheritance in such disorders, and if we have a family member who has such disorder, we should be screening other family members also, especially the first degree relatives like children and parents for such disorders.
Can we treat it in early age?
If we detect them in children, usually it does not, bipolar disorder can occur in children, but it usually does not present itself for the first time in children. After adolescence or early adulthood, it usually comes to light, but it is important that even if it comes then, we detect it and treat it early, so that the devastation it can cause is not caused and the harm to the person's life is least and minimal if it is cropped in the bud and taken care of early.
We are very thankful to our expert for sharing such an important information for our viewers. Friends, we'll be back very soon with another important topic on personality disorder. In case you still not subscribed our channel RTeamCreations, then subscribe it now and press bell icon for getting new notification. Till then, stay safe and healthy and spread a smile on others' face to make this world better. Thank you.